Thanks so much for joining us. I'm Glenn Mills. It is time to go inside Utah politics. We begin with State Representative Suzanne Harrison. She joins us from our backyard studio to share her thoughts on the COVID-19 pandemic. Representative Harrison, thank you so much for taking time to be with us this week.
Thank you for having me on the show, Glenn.
Yep, always glad to have you on the show, and I really wanted to get your perspective on this for two reasons. One, as a medical anesthesiologist, you are seeing this from the front lines, and two, you are also a member of the minority party up on Utah's Capitol Hill. So I want to get your thoughts here. Let's start off with what you are seeing at work in regards to this pandemic.
So Utah has done a lot of things right in terms of preparing for and having our healthcare facilities and healthcare workers be ready for this. We took a lot of precautions. I happen to work at an Intermountain Riverton Hospital, and from early on we've taken precautions to make sure that we have appropriate personal protective equipment, that we're taking precautions not only to protect healthcare workers, but most importantly, to keep patients safe. Right now, we're only doing urgent or emergent surgeries, and that means surgeries that really need to be done, or there's some threat to life or some serious consequence that can happen. But as we heard from the governor today, the governor made an announcement that we're going to start phasing in some of these other surgeries that do need to get done, but are not a matter of life and death, and we're able to be delayed for a little bit to make sure that we weren't overwhelming our healthcare system and preparing for COVID-19.
Yeah, dig into that a little more if you would, because that's what this was all about. We wanted to make sure we were not overwhelming the medical system. Is that not happening right now? Are things okay at this point?
So as a person on the front lines and as a medical doctor that is on a list of volunteers to work in the ICUs, should that need arise, I just want to thank the people of Utah and thank the many people in the state, the governor, that really took early and aggressive action to make sure that we minimize the spread of this disease. We know we have colleagues who are serving in New York City and other crisis centers right now, and we really did everything right here in terms of mitigating and minimizing the chance of a lot of people getting sick and dying. So we are not being overwhelmed in our hospital systems right now, and that's a good thing. And now we're going to be able to engage in those plans to get surgeries going and patients seen for other types of less critical care and less critical appointments and surgeries and so forth. So I fully support the governor's approach to this.
Okay, we'll get more into some of the other states' response, but I want to stick on the pandemic numbers for now. As of recording, we were over 3,400 cases, more than 280 hospitalizations, and 34 deaths. What do you make of the trends and the actual real data that is coming in day to day on this?
So I'm cautiously optimistic, and my heart goes out to the many families that have lost a loved one, or my neighbor was admitted and hospitalized for several days with COVID, and I know I have a colleague in the legislature, Representative Melissa Garf-Ballard, who lost her dad to this awful disease, and my heart goes out to everyone. But I'm cautiously optimistic about the numbers, that we are on the right path in Utah, and my strong encouragement is that we continue to listen to the medical experts with expertise in this field, the many infectious disease doctors and epidemiologists like the state epidemiologist, Dr. Angela Dunn, to continue to make those right decisions so that we keep patients and the community safe, and also that's key to being able to safely get people back to work and businesses back to work as quickly as possible.
As we look at all these numbers, they can kind of be overwhelming. We see charts, daily test rates, hospitalization rates. We see models out there, some of which appear to be projecting a worst case scenario. As we work through all this, what is the most important factor you think we really need to be watching to get a good gauge on what's happening?
Well, I think that the most important thing is that we are listening to the folks with expertise in these areas, the state epidemiologists, the folks with public health and infectious disease doctors and other medical professionals and medical doctors that know what they're talking about, and make sure they have a seat at the table as things are getting decided. We need to be very cautious that we're not just deciding things based on one factor or one issue, or one small part of the economy. We need to make sure that we're looking at the big picture so that we can safely get people back to work and businesses back to work, and also make sure patients are safe.
We've been hearing a lot about the idea lately that this could be a seasonal thing, or maybe we'll start to see it die down and then come back a little later once the cold and flu season kicks back up. What are your thoughts on that?
That is a concern, and the head of the CDC today stated that as well, that there may be concerns about a second wave, or that this becomes seasonal. And I want to say something. There's been a lot of people kind of stating that, oh, this is no big deal. This is just like the flu virus. Like, why are we being so, careful with social distancing and taking all these precautions? I just want to state very, very definitively, this is significantly more dangerous and deadly than the flu virus. This is a new virus. People don't have built up immunity over years of exposure to this virus, and we don't have a cure. We don't have a vaccine, and we don't have a proven therapy. So this is why we need to be very careful with this virus, and I want to get back to normal as quickly as anybody, and I want to cure as quickly as anybody, but we need to make sure that we're listening to the experts in their fields and working together with the various people at the table when things are getting decided, so we do this safely in the right way.
Representative, we're starting to see both state and local leaders modify their directives or orders.
Yeah.
What do you make of what you're seeing there? Are we starting to move in the right direction where we can start to loosen things up?
Yeah, and I support those careful steps that the governor is taking in terms of, letting surgeries start to happen that really do need to happen. We need to continue to be careful about social distancing, hand washing, all these kind of basic things with minimizing spread of infection. But I'm cautiously optimistic, and I think that we're heading in the right direction, and I support coming up with a plan for how we safely start to ease up on things.
You and your colleagues in a special session passed a bill expounding upon the Right to Try Act, also limiting liability and bringing in more experimental drugs. You've been a little concerned about this. Talk about why.
Yeah, so that bill, there were some really important parts to that bill, specifically offering some protections for people, for example, an ER doctor or a nurse that normally works in an outpatient clinic, that should the need arise, if our hospital systems did get overwhelmed, having some sort of protection for those folks to be able to come in and work in an ICU setting that's not their normal area of work or expertise. I think those protections in that bill were important. There were a series of amendments made to that bill that I think were critical in terms of limiting immunity for, new types of businesses offering or helping the state with distribution of unproven medications, and I think that was an important set of amendments that were made into that legislation.
What are your thoughts on these experimental drugs, though? I mean, on some level, we have had patients come forward and say, I tried this and it worked for me.
Yeah.
But what are your thoughts in trying unproven drugs at this point?
So this is where there's anecdotal examples of anything. If you just get on the internet, you can find anything about anything. And this is where I have concerns about the state coming in. You may know the state recently announced that they are going to purchase a large amount of this unproven medication, hydroxychloroquine, with taxpayer dollars. The jury is 100% out on whether this is an effective treatment. There are ongoing clinical trials to determine if it's effective. There is even some evidence out there that it's potentially harmful to patients that have COVID-19, and the FDA, along with a host of medical societies and a group of infectious disease doctors, are all urging caution. We need these medications to be studied in clinical trials so we find out if they're helpful. And I have concerns as a fiscal conservative about the state stepping in and using taxpayer dollars to purchase a large amount of unproven medication that's really not needed. We know that there is no shortage of hydroxychloroquine in the state of Utah. You already have access to this medication through normal channels. There are already patients that have access to it in our hospitals if the physicians feel it's necessary, and I think it's really unnecessary and an irresponsible use of taxpayer dollars for the state of Utah to step in and make such a large purchase.
Okay, I have a short amount of time left, but I got to get this question to you. Is it time to start carefully reopening the economy? We have about 15 seconds.
And again, this is where I think we need to make sure we have economists, public health experts, and medical experts at the table discussing this and deciding this. I think the best way to get people safely and quickly back to work and businesses back to work is to make sure we have adequate testing and that we're being led by the science and by good medicine.
Okay. Representative, we're going to have to end it on that note. Very great conversation. Thanks for joining us.
Thanks for having me.